So I'm going to talk to you about one case of interest in diving medicine. So this case is about a sudden hearing loss in a diver. This is a 44-year-old male who had only as medical condition dyslipidemia, taking medication for this, and he's been a certified diver for more than 30 years with over 1,000 dives completed. No previous diving accidents. And so while he was on a diving trip in the Maldives, he has been doing some scuba diving on nitrox 32%, 8 days of diving, 3 dives per day. He did one dive on February 16. He was in the water early in the morning at a maximum depth of 100 feet. It was a multi-level diving, a total bottom time of 50 minutes. He was within the nautical limits according to his dive computer, and he reported no difficulty in clearing the ears. So he did only one dive on this last day of his diving trip. So the next day, on February 17, he took a 4-hour flight from the Maldives to Dubai. And during the stopover in Dubai, he noticed that he was not hearing well in the right ear. So he had to take a second flight the next day on February 18 from Dubai to Toronto. And he was back home on February 20th. So first audiogram was done on February 20th. On this audiogram, we noticed a hearing loss in the right ear. It was a quite important hearing loss of about 80 decibels, mainly in the lower frequency. Tympanogram was okay, so the diver was put on prednisone and decided to contact the hyperbaric physician 2 days later, also on February 21st. And he was rapidly seen the next day on February 22nd. The examination of the diver, external ear canal and tympanic membrane examination was normal. We had signs of sensorineural hearing loss in the right ear. Neurological examination was okay. No vertigo on provocative maneuvers. So if we look at the definition of sudden sensorineural hearing loss, it's an acute hearing loss that develops within 72 hours. Hearing loss of at least 30 decibel, affecting 3 or more contiguous frequencies. Physical examination of the external auditory canal and tympanic membrane will show no anomalies. And the incidence is about 2 to 20 cases per 1,000 people per year. So I looked in the literature about what about sudden hearing loss in the diving population. So I found this interesting literature review that was published in 2016. In this literature review, and presented also 3 cases of divers with sudden sensorineural hearing loss that were treated with hyperbaric oxygen therapy. So literature review in this paper was able to identify 48 case reports. If we look at the baseline characteristic of divers with sudden sensorineural hearing loss that were treated with HBOT, the mean age was 36 years old. There was quite a the median maximum dive depth was mainly deep dive. The median was 35 meters. The median diving time was about 40 minutes. Diving gas was mainly compressed air for 65% of the divers. Also helium oxygen for 26% and trimix for only 2%, and surface supply air for 7% of the divers. What is interesting is the time between the dive and symptom onset. So in this literature review, it was only 15 minutes with a range from 0 to 30 minutes. The intensity of the hearing loss was a mean of 58 decibels. Vestibular symptoms were present in mainly 3/4 of the cases, and the time between symptom onset and therapy with hyperbaric oxygen was 333 minutes. The number of HBOT sessions, median was 3 treatments. Majority of, it was quite a wide variety of treatment tables for those cases, but the most frequent was the U.S. Navy Table 6 or the Royal Navy Table 62 for 40% of the patients. Only 10% receive corticosteroid treatment as an additional treatment, and diagnosis was in 94% inner ear DCS and 6% inner ear barotrauma. And what are the results of hyperbaric oxygen therapy for those divers with sudden sensorineural hearing loss? Full recovery was in over 40% of the patient, improvement for also nearly 30%, and only 20% had no improvement. Another interesting article is this one published in 2001, was a retrospective case series of 29 cases of inner ear DCS. Again, we can see there's a very short interval from the end of the dive to the symptoms, only 47 minutes, and about 83% with symptoms in less than 1 hour, and 97% within 2 hours after exiting the water. Pure vestibular insult alone, so vertigo, dizziness, 34%, and pure cochlear insult alone, so deficit in hearing, for 14% only, and a combined mix of the vestibular and cochlear symptoms on 52% of the divers. So what we did was, for this diver, the first treatment was a U.S. Navy Table 6 for nearly 5 hours in the chamber. We can see that the audiogram after the first treatment on February 22nd, where we had some improvement. And then we continued with treatments daily at 2.4 for the next day, and then it was treated at 2.8 and for the third day and fourth day. And the patients shown some good improvement. Like I said, after we have the audiogram, or where the deficit is now only about 40 decibels instead of 80 decibels. And after the fourth treatment, we have a deficit of only 16 decibels in some higher frequencies. About this case, what was unusual for inner ear DCS is the time between dive and symptom onset was very long. It was over a 24-hour period compared to a mean time of 15 to 45 minutes in the published case series. What was also unusual, this diver had no vestibular symptoms. Other case series reports show that up to 75% of divers will have some vestibular symptoms, vertigo, dizziness. And also what is strange in this case is that the symptoms did not seem to worsen during the second air flight, because usually going in the airplane, the ambient pressure will be lower, so you would expect that the symptoms would get worse with a DCS while traveling in a plane. So for this diver, was it really inner ear DCS, or was it sudden idiopathic neurosensorial hearing loss? Both could be possible, but what is interesting in both possibilities, hyperbaric oxygen therapy is a recognized treatment. So whatever was really the diagnosis for this diver, the hyperregoxygen therapy was good to help this diver recover. And just remember that unusual presentations do exist. Patients do rarely present like it's supposed to be in textbooks. And this diver made a full recovery and was able to return to diving, and had done many dives since this incident, and without any other event like this.